I call it an annuity because 95% of patients that have that lens will reorder it again. And last year, we had 8 patients the entire year that tried them, that returned them. 8 out of several thousand patients.
Mark Hinton is my guest for this episode. And talk about an agent of change. He's the CEO of EyeFacilitate, where he coaches optical retailers to connect with their patients so they can increase profit and patient loyalty. And this conversation is going to give you a lot of motivation, a lot of potential ways to think and talk in your practice to reach new levels of success in your optical. Check it out.
This is the Think Again podcast.
Mark, I want to talk to you about the challenge that you love to give others. You have this, I guess I call it a coaching mindset. Where does that come from? Does it come from your educational background? How did you get to be so motivated as to get others to think again?
I think that really evolved years ago when I was so painfully shy that my mother put me on stage in front of hundreds of people in musical community theater. I got a taste of it and people did this and I went, oh, that didn't hurt. That's not so bad. And I found that, as well with my psychology background, I had so many people asking me questions about, well, how do you do it? And I found myself really asking them more questions back. And I realized it's like, I really don't have an answer until I ask another question. We're quick to defend, we're quick to answer a question without really thinking about it. I think that I look at inside practices and they continuously stub their toe, but they don't go back and try to fix the stubbing of the toe. They just stub it again. So I have this mindset of passion about optometry. I have a really strong belief and intention about doing the right thing for the patient. And I just don't love big box optical and internet optical because I feel like this is something that is so important to put, in front of the patient's eyes and to do the eye health exam, with all of the availability that we've got to be able to provide to that patient. We just don't communicate well.
I was just going to start asking about that. So I think that every listener right now is saying, I've got a system, it works. I've got an optical handoff, or I've got a flow sheet that I make check marks on and I make good recommendations. But if we were to talk about looking at the assumptions in an eye care practice right now, what's the very first thing that an owner listening or even an optician listening should rethink immediately?
I think connecting the clinic and the optical together instead of we, they, them, and us. Because it's fascinating to me how many patients don't know that the doctor owner actually owns the optical. It's a separation. It is, I'll write your prescription. I'm recommending that you get some sunglasses today to protect your eyes when you're outdoors. And, it's very, very vague. And I feel like it's one of those things where you've got to connect the dots. 2, you're going to be meeting with my optical specialist in a few minutes, and they're going to fill your prescriptions exactly the way I want them for you so that you and I know that they're crafted correctly and without errors. And that's a different type of language than I recommend that you get some sunglasses. And I recommend that, you get some computer glasses. It's really not a matter of recommending. It's a matter of prescribing it and getting to the why. And then in the handoff, it is really sharing with the optician what the doctor and the patient confirmed together. So it's that communication between the clinic and the optical. And of course, we measure both of those on a daily, weekly basis because we don't do one really well without the other.
Yeah, I'm going to get to data in a second. I want to finish by talking about this large banner that you put up of communication. The idea that the systems that are in place convey a certain mindset to the patient. Also, you talked about the they them kind of thing, like my optical technician. I'm not saying that's bad wording, but isn't it interesting that it was as recently as maybe 30 years ago where we would walk a patient out. Sometimes the doctor would start maybe a frame selection, that there was
Yes.
this much clearer connection to my examination and clear and important refractive effort to the eyewear you're going to get that'll deliver you that visual benefit. We don't do that today.
No, there's a lot of separation with that. Look, we're running such busy schedules. It's like cram more in. I don't know about you, but during the pandemic, when we decided we weren't going to see patients every 15 minutes because we couldn't, we actually our revenue and our profit was higher because we weren't rushing. What doctors tell me is, gee whiz, I don't know how I'm going to be able to do all of this because I don't have enough time. And when we don't have enough time, or when we get in a hurry, or we're behind, then what happens is we're not communicating as well. It gets thrown out into optical, and it's like, then the optician says, well, did the doctor say anything to you about? Have you heard of? Have you ever considered if you were thinking you wanted? And all of that confuses the patient, to a really high degree. We have to be very, very clear. And another thing that I recognize and makes a huge difference in the practice is confirm with the patient whether they want it or not before they leave the exam room. I want to prescribe sunglasses to you with filters and treatments that are going to eliminate the wavelengths of light that can be damaging to your eyes over time and lead to vision loss. We see this with skin, but rarely do patients think about it with their eyes. Would that be a good idea? And the patient's going to say, that's a good idea, or they've got another question. But typically what I hear when I sit in on exams is, well, it's really important to protect your eyes from UV rays. We found out people didn't know what UV rays were. Hey, I have to ask you this. Every word makes a difference. Were you ever in a situation where you were prescribing for the patient, said, I'm going to update your prescription today? And then 5 minutes later, the patient said, is there a change in my prescription? We've all run into that. We made one little switch. We got rid of update and moved it to, I'm changing your prescription today so you'll see sharper and clearer. You'll be far more comfortable, far more efficient and productive throughout your day. And it reduced the amount of people that came out to optical going, did my prescription change? It's stunning.
I was public enemy number one as a doctor back then. When I examined, right? I was poor at conveying. That is a great way to think about conveying the message to the patient.
We only know what we learned, right? And we only know what we know. And so it's a matter of when you look at it and it's not working, why isn't it working? It's like, it's always been about recommending glasses, and then somebody's going to sell glasses. And I always share with the optometrist, your optical is your pharmacy for lenses. Every lens and every lens treatment that you're going to prescribe to that patient is going to gain them an advantage or help them avoid a disadvantage. And that is our goal. Sharing with patients third-party stories as well. I see patients every week in this clinic that would do anything to regain their sight. But once it's gone, we can't do that. So I want to be proactive with you in making sure that every year when you see me at this same time, I can tell you that your eyes are healthy and I don't see sun damage. I could imagine that's pretty important for you. Am I right? And the patient's nodding their head. Yeah, you're right. Why? Because it's just logic. We have to get to the logic. What do they stand to gain? What do they stand to lose? And then how can we help them avoid it? It's fascinating too that we recognize most people own one set of eyewear, because mostly that's what doctors recommend is one set of eyewear. And you might want to think about some computer glasses. You might want to think about some reading glasses, which is not prescribing. It's, could you imagine you go into your cardiologist and he says, you might want to think about a pacemaker. It's like, what? It's like, tell me what I need and tell me why I need it. And then ask me if I want it, because if I want it, then what's going to happen in the handoff? It isn't, I'm prescribing this to Nancy today. It is, I want to share the decisions that Nancy made regarding her eyewear, what I'm prescribing, and why I'm prescribing it. Nancy wants her eyes protected from sun damage. So I'm prescribing the sun darkening lenses to her for whenever she's not wearing her sunglasses. And I'm prescribing her sunglasses for her for when she's driving and outdoors for prolonged periods of time. And so we said, Nancy would like to have, or Nancy sees the importance in, Nancy understands the advantage of. And it's interesting, Dr. Jens, because people really want to be included in their healthcare. It's just, I have a very strong belief that optometrists are concerned that if they get the patient's endorsement or confirmation to what they want to prescribe, it will come across as being salesy.
The Think Again podcast aims to challenge conventional thinking that ODs have about running their eye care businesses. Subscribe, like, and share all of what we deliver so you and your colleagues can get better at what you do.
Optometrists are concerned that if they get the patient's endorsement or confirmation to what they want to prescribe, it will come across as being salesy, pushy, when in fact, it's absolutely the opposite.
The consumerism of healthcare trend is irreversible. It's well in motion, and to involve patients means doing what you're talking about and bringing them into the conversation as the third leg of the stool, as opposed to having a discussion with somebody that's called a handoff internally using scientific terms and lingo. I get it. Yeah. So we talked about measuring earlier. One of the things that we use to measure our practices is revenue per exam. Right. And that covers both the optical approach and the examination approach. I'm sure there are conventional ways to do it, which happen to be wrong, to drive that number up. But tell us, if you were giving a miniature version of one of your in-office consultations, how a practice should think about revenue per exam tomorrow.
What are our opportunities that we're missing? Okay. Because when I recognize that most patients buy one set of glasses, and then what do we have in the way of inventory for those people? Because the higher the level of our frame that we have, the more revenue we make from that. Because we already know that if we're accepting managed vision care plans with the write-offs and with frames that we've got for below wholesale frame costs, for example, or right at it, we're just not profitable. And so when I'm going to work with a practice, there are things that I want to know, and it's interesting how many of them they don't know. I want to know about how many Plano sunglasses does your office sell in a quarter. I use the word sell. Sell rhymes with hell, but I'm going to use it in this particular meeting that you and I are having. So how many do you sell? And they go, I don't have any idea. It's like, how many pingueculas do you see on an eye in a week? I'm asking the doctor. I don't know, somewhere between 10 and 50. It's like, well, what is it? Because that's a category that we can absolutely grow for those contact lens patients who, they were wearing glasses. It was covering the entire sclera. Now we're going to remove it, put a corneal cap on there called a contact lens, and not have any conversation at all about sunglasses. So that's a huge opportunity. We miss it with sun darkening lenses, transitions, for example. Why are they around? Because they're convenient. No, they're more than that. When you think about photopsin, rhodopsin, and other photochemicals, that assist with excessive light during the day, and they're bleached out with the amount of light, that is a lens that if the patient wears it during the day, they're going to see better at dusk and after dark. That's been measured. We also think about that as being a real, I call it an annuity, because 95% of patients that have that lens will reorder it again. And last year, we had 8 patients the entire year that tried them, that returned them. 8 out of several thousand patients. And my net on that is roughly $60 per. And every child should be wearing it because parents don't buy their kids sunglasses. But we don't talk about it right. For women in particular, we talk about sun darkening lenses as that is the lens that you would want to wear all day long. Just like when you get up before you head out the door, you put your moisture on it, and it's got that light SPF in it, 10, 15. When you're going to spend some time at the beach or out on the trail or wherever you're going to be, you're probably going to put your sunglasses on. So those are your SPF 50. And, it's just an interesting opportunity for us. So I look at these and think about, revenue per exam. I'm looking at capture rates historically, crazy, low 40s, high 30s. And then I look at, okay, because we have patients that want to go to big box and because they want to buy on the internet, do we have affordable eyewear? Not packages, but do we have affordable choices? Do we have the right things in place for them? Because all of this is going to affect our revenue per exam. So, if it was scleral lenses and it was managing meibomian gland disease with RF and IPLs, heck, we could close down the optical probably, and our revenue per exam would be $1,050. But we want that optical, but it's not paying for itself because we're missing connecting. We're missing the opportunities to prescribe. I always say, look, you got to have a really good checklist for optical. The checklist is how we don't crash the plane, but a lot of it's verbal. She's going to get her progressive glasses today. She might be interested in some computer glasses, give her more information about, explain the this and that. And it's like, no wonder there's never an optician ready to go into the exam room to pick up the next patient, because we're sitting there explaining stuff to them in optical. Have you heard of? Have you ever considered? Did the doctor say anything to you about? And it's unnerving to the patient. So if we were just really good at collaborating, asking the right open-ended questions of the patient at pre-test to set up targets and opportunities for the doctors, then the doctor's letting the patient know, we started a checklist today so we don't miss anything that's important for you. And then prescribing with why. And then being able to do a handoff that isn't about, she'll help you with your glasses. That's not what pharmacists do. They fill prescriptions. This is Carol, my optical specialist. She's going to fill your prescriptions so they're exactly the way I want them for you. Perfect. Okay. Patient nods their head. All Carol's got to do is say, I'm going to fill your prescriptions exactly the way Dr. Jen wants them filled for you so that you see sharp and clear, and we're going to protect your eyes from sun damage today too. And we're waltzing.
Yeah.
So that was a roundabout way to say, what about revenue per exam? I asked the questions in advance. What are your percentages of this, your percentages of that? It's sort of like looking at Jay and Evan's dashboard, of what are the opportunities? What's the report card? What does that look like? And in fact, I've had some folks that have said, can you come and work with us? And I say, well, how often do you have office meetings? Once a quarter, sometimes once every, and I say, are you willing to have an office meeting every week, at least for the next 10 weeks? Because we're going to have a four-week implementation plan that you're going to work on. But are you willing to have the meetings? Because you got to get together to measure it and say, yeah, we're definitely building here, or we're flat, or we got to get Mark on a Zoom call because this part of the piece isn't working. I said, could you imagine your favorite team, your favorite football or soccer team making it to the World Cup or the grand playoffs if they didn't practice in between games? They won last week, but guess what? They're practicing this week because there's a whole other game that's happening in a week. So it's kind of waking it up, shaking the snow globe a little bit, getting us thinking differently, breaking the status quo. As your friend and mine, Jay Binkwitz, says, we disrupt. We have to disrupt it in order to rebuild it, in order to rethink it again.
I love that. So let's close with this. Doctors are listening. They've been motivated. They're thinking about how in the world am I going to fit in a staff meeting every week? Listen, docs, there's ways to do it. Contact Mark if you want to know more. But I want to go to what I think might be a core matter. Maybe you'll disagree. I like to see doctors prescribing a prescription in their EMR for every use the patient has, not one where it's filled 4 different ways, but there's specificity to computer RXs, specificity to sun, specificity to photochromic. that takes a little bit of time with good systems. Now you can sort of copy, adjust, and make a new one. Do you agree or disagree that we should be making prescriptions that are, to your point, the exact ones that we want our pharmacy, our optical to fill? Or do you think that's too much work? Is there a different way to do it?
No, I think it's absolutely imperative for sure that the patient hears that I'm writing 3 prescriptions for you today. I'll recap with you what they are and why I'm prescribing those to you. And it's as different as shoes. I mean, I got my going out to, the club shoes, and then I got my sneakers, and then I've got my hiking boots, and I'm not just pulling the heel off and putting another heel on, I'm changing out the shoes. So, it's really important when the patient hears it, they start to gear up for, wow, and because patients are used to one pair of glasses, the doctors that are going to hear what you and I are, mostly me talking, I know, but what we're discussing in this format today is we're going to have patients that go, oh my gosh, you want me to get 3 sets of glasses or 3 pairs? And we say, well, yeah, based on the exam information and the information that your eyes provided me today and what you've shared with me, I found 3 unique needs that are going to, number 1, help you maintain healthy eyes. Number 2, help you perform at a higher level and be more comfortable. And number 3, have you seeing as sharp and clear as you possibly can. You can prioritize this. Tell me right now what you're thinking. Well, I'm thinking it's going to be a lot of money. Well, and a lot of money is a relative thing. It depends on the importance, but I will share this. The majority of our patients really like being able to pay with easy pay, over the next 6 months without any interest. It makes it easy for them. Dr. Jens, you brought that up, and I wanted to lead with that too, because the average household has around $500 in on-hand cash, if you will, without going into accounts. So food costs more, rent costs more, insurance costs more, gasoline costs more. We have all of these costs, and yet we haven't really seen a significant increase in salaries or hourlies. And with that, patients are finding it difficult to buy their glasses. And the reason I know this is speaking directly with the folks at Care Credit, which is Synchrony Bank, and asking that question. And our answer back was about $500. So we've just decided that if patients don't think they can afford it, 30 minutes into that meeting with the optician gets to the money part, and the patient says, oh, I need to think about this. So we got 30 minutes sitting there with the patient for them to leave, and we got about $2 a minute in production costs sitting there. So it just cost more than $60, and we didn't make a dime. So we really have to be able to simply not pause when we tell them the price, but the list would have been $800. With your vision benefits, yours is just $400, saving you $400. So happy we could do that for you. Would you like to use a credit card, a check, or 6 months easy pay? Holy smokes, in our office, our multiples started going through the roof because people need to be able to see a path to getting what they want. We got it. We don't talk about it, but I'd far rather have that other pair for a few percent more than to have the patient not get anything at all or just get the one pair. And once the patients start having 2 and 3 sets of eyewear, they never want one again. So we got to really get our game good on that. Opticians have got to stop selling and they've got to start filling. If the patient nods yes in the exam room and then comes out and does this to the optician, nobody wants to disappoint their doctor. So it's like the optician's got to be able to just, be frank about it without being salesy and say, Tom, I know that you decided in the exam room that you wanted to include your sunglasses. Share with me, where you're second guessing yourself and let me help you with this. And that will often flip into the sale because the patient will say, I'm just not prepared for it right now. I need to talk to my wife. I need to think about this. It's like, it's going to be a lot of, and more often it's simply because of money. So if we can make it easy for the patient to be able to purchase, if we could knock down the walls, the barriers, and the roadblocks, and simply lead the patient where we want them to go instead of helping them opt out every step of the way, we would have much better success with our patients. Will it take time? Yes, it will, because we've conditioned our patients to buy one. So it's going to take 2 or 3 rounds before we're going to really see that success. Nonetheless, it happens. And we see capture go up when we're able to answer the patient. The patient says, I just want to get a copy of my prescription today. Oh, yeah, sure. We'll make sure you've got that. Let me print it. Off you go. We're here if you need us, except they're not coming back. It's easier to keep them. So the patient says, I just want to get a copy of my prescription. What makes all the sense in the world is, of course, you'll have your prescription. Listen, let me ask you this. Do you have someone in mind to fill your prescription for you? Yeah, I do. And I say, what do you feel like we're missing that you need? Well, you guys have really nice glasses. This is a nice looking place. You actually have carpeting and you've got like really nice displays, and gee whiz, you actually have fabric in here. It's like, so I'm going where it's concrete floors and I know the glasses will cost me less. And I just made all that up. But you know, the fact is this is what's going on in the consumer mind. All glasses are the same. We don't make that distinction of, we don't correct your sight here. We optimize it. And all lenses aren't the same. Some will correct, some will optimize. I'm designing your lenses for you today in order to optimize your best possible sight. Pat, is that important for you? Yeah, it is. Good. I'll make sure that that's what you've got. My optical specialist is going to make sure to fill it just the way I want it for you so that you and I can feel confident that we got this right. Sound good? Patients all in. Made it all about them. It's so much fun.
Folks, now go back to the beginning, rewatch, and start writing things down, because that's Mark Hinton, EyeFacilitate, and he has given you the beginning of the ways to change and think again about your optical business. Mark, thank you for being our guest on today's Think Again podcast.
Scott Gems, I enjoyed it so much. It's so great to see you again, and happy to entertain, you know, any questions, thoughts, or needs from the listenership.
Fantastic. Thanks for knocking out the hits. That's it for today's Think Again podcast, brought to you by GPN Visions, a peer-to-peer learning community to help grow your eye care business.